Can you get blood clots while taking blood thinners? Let's talk about it. Did you know that even if you're on blood thinners, you're not 100% protected from getting blood clots? I recently had a scare when I woke up one morning and I had a lump in my elbow. And I called my doctor immediately. He told me to make my way down there as soon as I could. Once he saw it, he sent me to imaging immediately because it had all the markings of either a blood clot or an aneurysm. And that's not what you want to hear when you have a blood clotting disorder. But wait, I'm on blood thinners. I can't get blood clots, right? So, first things first, what are blood thinners? So blood thinners do not actually thin your blood as the name suggests. That's actually just a misnomer. Blood thinners have specific tasks that they do to help prevent your body from forming clots. And blood thinner medication is either anticoagulant or they're antiplatelet. So anticoagulants actually slow down your body's ability to be able to form a clot or prevent existing clots from getting larger. And antiplatelets, well, they actually stop your platelets from sticking together and forming clots. And just a note, neither of these medications actually dissolve an existing clot. So here's the key. Blood thinners reduce the risk of clotting, but they don't eliminate it 100%. And so the answer to my question, can you get a blood clot while taking blood thinners? The answer is yes. For some people, it's absolutely a yes. So if our answer is yes, then what are the factors? So number one, let's look at incorrect doses or missed doses. Blood thinners work by keeping your blood at just the right level of blood clotting control. And there is a balance. I mean, you take too much and you're at risk for bleeding. But if you don't have enough, then you're at risk for clotting. Now, for some people, even missing one dose can cause you to get a clot. If you miss a dose, or if you're not sure about your dosage, it's always best to talk to your healthcare provider or your doctor. Because remember, it's always better to be safe than to be sorry. The next thing is that factors such as immobility, dehydration, surgery, and infections can increase the risk. And the next factor is that it's an individual response. Some people are just more prone to clotting than others, even with medication. Okay, so the fourth thing is drug and food interactions. These can interact with your blood thinning medications and cause them to be either hyper effective or less effective. In this video, I actually talk about the importance of keeping a consistent diet in order to keep a consistent INR level. And this is why diet and medication awareness is so important. And the fifth thing is blood clotting disorders such as I have, APS. The disease itself makes your blood more prone to clotting, even with medication. As always, make sure you follow your doctor's advice. So let's move on to how we reduce the risks. And the first thing is to take your medications as prescribed and keep your doctor in the loop if there's anything abnormal going on. And the second thing, if you're on warfarin, you have to have regular INR checkup. The third thing is to make sure you're staying mobile and hydrated and follow your doctor's guidance on that. And the fourth thing is to watch out for the signs of blood clots. So if your legs swell or your arms swell or you have chest pain, or if you have a weird rash or a lump, seek medical attention ASAP. Remember, it's better to be safe than to be sorry. Back to my doctor's visit. After the scans, they came back, it was not a clot and it was not an aneurysm. They actually don't know what it is. However, it does show the seriousness of staying on top of your health. I know this is getting irritating, but I promise it's true. It's always better to be safe than to be sorry. So if you've had a scare similar to this or a situation similar to this, leave it in the comments down below. And of course, don't be too specific, but just share some of your experiences with it. And if you found this information helpful, we would appreciate if you would like and subscribe. Okay, I'll see you next time.